This is an orthokeratology case where the patient's returning after a couple years of wearing lenses, and we've got some residual cylinder in both eyes, and in the left eye, we've got a little bit of decentration of the lens up and out. So in the right eye, we can see this irregular bow tie pattern in the center of the lens, and the patient's got about 3/4 of the doctor with the rule of astigmatism. Most of the time, this is from um, the vertical meridian being looser than the horizontal, and so the solution is frequently to tighten the vertical meridian up in the periphery. In this case, though, I think what we should do is loosen the horizontal a little bit, and that should help with the irregular astigmatism there. Centration doesn't look too bad in this eye. The treatment zone does look like it's drawn out a little bit, but I think making that adjustment to the periphery and the horizontal meridian should help with that. In the left eye, we've got a little bit more decentration, and the reverse curve is not as well defined. I've got some unusual flat spots, but these might be artifacts in the topography that, or sometimes with older lenses, you may have some deposits that are causing irregular molding at the center of the lens. And there's even a chance that just simply replacing this patient's lenses will resolve a lot of these issues. Sometimes older lenses will mold differently just because they've warped a little bit over time or have some deposits that are resistant to removal. With lateral decentration, most of the time we want to make the lens a little bit bigger, and due to the way that topography looks here, I wasn't able to measure the corneal diameter, but it looks like we're using fairly large lenses, I think at about 11.3, so that's something I would double check, just recheck the corneal diameter, and you can probably go zero point 0.2, zero point 0.3 millimeters smaller than that, so that gives you a little bit of room to increase diameter. You can go ahead and do that. That should help with the centration. In the right eye, let me bring up the lenses. So here's the lens for the right eye, and what I mean by loosening the horizontal meridian is to go into 50% mode and just lifting the periphery a little bit so that we get a little bit less bearing in just this direction. So I went about 7 clicks. It'll appear that your central clearance is decreasing, and to a degree that may be true, but not as much as the graph would indicate. Really what we're doing is just lifting the periphery and keeping the vertical alignment the same as it is. That should give us a little bit more homogeneity in the optic zone of your post-treatment maps. For the left eye, because the topography has some irregularity to it, it's harder to decide exactly what to do. I think what I would try to just I think what I would try first is just to make sure that you're at the largest overall diameter you can go. And this does kind of look like just a sloppy topography from an old lens, and especially if you haven't seen this type of decentration or unusual flattening in your other topographies in the past, I'm pretty comfortable just changing this lens and refreshing it as it is. I don't particularly see the bow tie that we see in the right eye, and so even changing the periphery of the lens, it's hard to decide exactly which way to go. And if you've gotten pretty consistent and reliable topographies that don't show this irregularity in the past, I would just refresh the lenses and go from there. So hopefully that helps. Best of luck with your patient, and thanks for watching.